Lincoln Recovery Center, Client Orientation.
We support your decision and congratulate you for wanting to make the behavioral changes that will improve your physical and mental health and enhance the quality of your life. We are here to help you succeed. On behalf of the entire team, we welcome you to Lincoln Recovery Center, LRC. We know that seeking treatment for a substance use disorder is not easy, but the decision you have made today is an important and courageous one. If we are facing in the right direction, all we have to do is keep on walking. Zen proverb. Treatment. You can complete LRC's outpatient program in 3 to 12 months, depending on the following factors: your participation in the program, your commitment to your recovery, the number of goals you want to achieve, your willingness to change your behavior, how quickly you develop your new skills. Individualized treatment plan. Once admitted into the program, you will collaborate with your counselor in the development of your individualized treatment plan. LRC treatment adheres to the client-centered approach recommended by the New York State Office of Addiction Services and Supports, OASAS. This theoretical approach is underpinned by the belief that clients know themselves better to be able to identify and prioritize the issues that concern them most, such as fulfilling a treatment mandate. The counselor guides and supports, while clients steer their ships. Program schedule. The program schedule at LRC for most clients entails attending and participating in English or Spanish speaking group sessions 3 days per week, from 9 a.m. to 12 p.m. on Monday and 10 a.m. to 12 p.m. on Wednesday and Friday. In addition to this, you are required to attend a weekly 30-minute in-person individual session with your counselor. MAT, Medication Assisted Treatment. LRC provides a holistic approach to the treatment of substance use disorders, SUD, combining the use of medications with evidence-based behavioral therapies and practices. Research, SAMHSA, indicates that the use of medication and therapy increases the efficacy of SUD treatment, retention in treatment, and patient survival. LRC recommends food and drug administration FDA-approved medications such as Vivitrol or acamprosate for alcohol and Suboxone for opioid misuse. Speak with your counselor if you would like to learn more about this or if you would like to be prescribed these medications as part of your SUD treatment. LRC Community Health Worker. LRC has a community health worker, CHW, in residence with many skills: outreach worker, community health representative, health coach, patient navigator, health advisor. She is available for consultation and services if you need additional support while in treatment. Your treatment information is confidential and safeguarded by the Health Insurance Portability and Accountability Act of 1996, or HIPAA, the federal law that protects your information. This means that we cannot confirm or deny your enrollment in our program to anyone who might contact us without your explicit permission and signed consent. If you would like us to speak to anyone about your treatment at LRC, make sure you sign the appropriate consents that would allow us to do so. Once you complete the program, you will have two options: either to be transferred to the continuing care track, which entails a monthly, in-person, individual session with your counselor, or to move ahead with your new life on your own. The continuing care track provides you with the support you might need after you have successfully completed your treatment and can last as long as you want. It is optional and entirely at your discretion. Substance use disorder, SUD. Modalities. Substance use disorder treatment is mainly delivered through two modalities: group and individual sessions. Group sessions are 45 minutes long and individual sessions are 30 minutes long. All therapy sessions at LRC are facilitated by a credentialed alcohol and substance abuse counselor, also known as a CASAC. All groups at LRC focus on different but complementary topics selected to help you build a robust foundation to anchor and support your recovery. We ask that you participate actively in all your groups so that you can maximize the benefits of treatment. Group rules. 1. Group starts and ends on time. 2. Please make sure your mask covers both your mouth and your nose. 3. Please turn phones off. You are not allowed to use them in group. 4. Hats or caps are not allowed in group. 5. Sleeping in group is not allowed. 6. Please do not exit and enter during group. It disturbs the group's rhythm. 7. What is said in group stays in group. 8. Only one person speaks at a time. No cross-talking. 9. The group respects the experiences and decisions of its members. 10. Please share your experiences and use the first personal singular pronoun, I. 11. No member dominates the conversation. Everyone has a right to contribute. 12. The group is a safe space to speak about your feelings, obtain support, information, encouragement, and trust. 13. The group is defined broadly. It's flexible to adjust to the needs and interests of its members and to provide opportunities to diminish anxiety. 14. Efforts will be made to resolve any conflict between members before the end of group. 15. Respect is earned, respecting others. Please, be respectful. If you are unable to attend any of your scheduled group or individual appointments, we ask that you call us at 718-579-4065 to notify our front desk person, Mr. Ruben Ramos, of the reason why you will not be attending your session. Failing to do so will result in you being marked as a no-show on that day. Missing too many scheduled group or individual appointments might lead us to schedule a team conference to discuss the reasons for your absences and the ways in which we could help you resolve them so that you can re-engage in your treatment. Clients enrolling in the program following a recommendation from the Administration for Children's Services, ACS, parole, probation, employee assistance programs, EAP, or the New York courts. If you are enrolling in our program as a result of a mandate, we commend you for accepting the recommendation to access treatment services at this time. It is difficult to change our behavior when someone tells us to do it. We often get angry and frustrated and refuse to do it, which then gets us into more trouble as we are penalized further. To avoid this, we ask that you try to avoid seeing your treatment at LRC as a mandate as much as possible, and to try instead to view it as an opportunity to examine your life, to grow and improve, and to make the behavioral changes that will benefit you, your family, and your community. Take this opportunity to make this experience about you, and only you. If you do this, you will benefit personally and meet the conditions of your mandate. Toxicology testing. All clients in the program are tested randomly for alcohol and other substances on a weekly or bi-weekly basis. If you need to complete treatment to resolve a family or legal issue, you will be tested randomly every week. This is done to help you build up a robust, successful treatment report that will help you resolve any family or legal cases you might have pending. Negative toxicology reports are also a positive benchmark that evidence your ongoing sobriety from all substances and your improved physical and mental health. They could also help you evaluate your personal growth during your time in treatment. If you are still using substances or have relapsed, we ask that you talk to your counselor before you are tested to safeguard the trust that will develop between you and your counselor. In recovery, as in life itself, it is important to be honest and to have the courage and humility to admit when we fall short in reaching our goals. As the 18th century poet Alexander Pope once said, "To err is human, to forgive is divine," meaning that all human beings make mistakes and that we should acknowledge them to be able to learn from them. He believed that we should forgive others when they make mistakes and that we should also forgive ourselves. So please, talk to us before we request a sample from you to send to the lab. Inappropriate behavior. Inappropriate behavior is conduct that is unjustified, demeaning, threatening, or offensive, such as flirting or becoming romantically, sexually, or financially involved with another client or a staff member. Staff members accepting gifts from clients is considered inappropriate as well as unethical behavior. These behaviors should not happen, but if they do, please report them immediately. Lincoln Recovery Center does not allow behavior or comments that demonstrate hostility or aggressiveness towards other clients or staff members. LRC policies and practices do not discriminate, nor do they allow clients to use discriminatory, offensive, or intolerant language or expressions based on race, immigration status, sexual orientation, gender, or gender expression. Please refrain from behaving inappropriately in the clinic or from making comments that others might find offensive. Supportive and inclusive care for all community members, LGBTQ. Lincoln Recovery Center gets it. Why wouldn't we? We are proud to stand by and with you, supporting you in building the foundation for your recovery, or to assist you to get back on track. Client feedback, complaints, and medical records. At Lincoln Recovery Center, we encourage you to give us verbal or written positive feedback about a particular member of our staff or the services you are receiving or that you have received after completing your SUD treatment. Equally, you have the right to complain about our services or about any member of our staff who you believe might not be satisfying your treatment expectations. You can discuss this in complete confidentiality by requesting a meeting to speak with the clinical supervisor and the program director. You have a right to request a copy of your medical record, but please make sure you schedule a meeting with your counselor to discuss the specifics of it and the time necessary to prepare it for you. Discharge preparation. Your treatment discharge is an important process that requires preparation, careful planning, and important consideration to ensure that your recovery is not negatively impacted by the ending of clinical services. We strive to begin the discharge conversations approximately 4 to 6 weeks before your actual discharge from our program. These conversations will help you explore your feelings about ending treatment, your sense of preparedness, and assess the extent and quality of your support system. We recommend that you become a member of a robust support network, such as the 12 Steps of Alcoholics Anonymous, AA, or Narcotics Anonymous, NA fellowships. As a member of these fellowships, you could identify your home group and obtain a sponsor who would help you maintain the stability in your recovery. LRC hosts NA and Smart Recovery support groups, on-site, off-site, and on Zoom. Ask your counselor about these groups. Upon the successful completion of your treatment at Lincoln Recovery Center, you will receive a letter attesting to this achievement. Each year in December, we hold an acknowledgement ceremony for all the clients who successfully completed their SUD treatment during the year. During this ceremony, you will have the opportunity to talk about your experience with your peers and receive your hard-earned certificate of successful treatment completion. Consent to share information documents. Your counselor asks you to sign documents to consent to share information about you for the following reasons: to report any transmissible diseases, to report behavioral health admissions, to inform you about your confidentiality rights, to obtain your informed consent for treatment, to report your substance use, misuse, to assess level of care, to evidence your agreement about our therapeutic contract, To obtain your consent to contact you at home for telehealth services. To evidence your agreement to receiving treatment services from LRC. To share your information with the New York State Office of Addiction Services and Supports, OASAS. To obtain your consent to share treatment information with your partner, family, lawyer, doctor, etc. To inform you about your rights under the Health Insurance Portability Accountability Act of 1996, HIPAA. To obtain your consent to share treatment information if you enroll under the Drivers Under the Influence program. Narcan. What is Narcan? Narcan is a medication used to counteract the effects of opioids such as oxycodone, heroin, Vicodin, codeine, morphine, methadone. Naloxone is a generic name of Narcan. Naloxone quickly reverses an overdose by blocking the effects of opioids. It can restore normal breathing within 2 to 3 minutes in a person whose breath has slowed or even stopped as a result of opioid overdose. More than one dose of naloxone may be required when stronger opioids like fentanyl are involved. Naloxone won't harm someone if they are overdosing on drugs other than opioids, so it's always best to use it if you think someone is overdosing. If you give someone naloxone, stay with them until emergency help arrives or for at least 4 hours to make sure their breathing returns to normal. Signs of overdose. Recognizing the signs of opioid overdose can save a life. Here are some things to look out for. Small, constricted, pinpoint pupils. Falling asleep or losing consciousness. Slow, weak, or no breathing. Choking or gurgling sounds. Limp body. Cold and or clammy skin. Discolored skin, especially in lips and nails. Please do not leave this session before you are trained on how to use your Narcan kit. After that, please carry it with you everywhere. You never know when you might save a life. The Good Samaritan law in New York was passed to protect from arrest, charges, or a combination of these, individuals who are overdosing and anyone assisting them. Thank you. You have now completed Lincoln Recovery Center's client orientation and information session. Thank you for your attention to it. Your counselor will provide you with your own abbreviated copy of the information presented here. Your counselor will hand you a second copy for you to sign. Your signature serves as evidence of your attendance at this session and confirmation that you received your copy. The Lincoln Recovery Center team. Hardships often prepare ordinary people for extraordinary destiny. C.S. Lewis.
Let the journey begin.